Hi, this is Dr. David Klein in Connection Studio. Connections Radio Studio, Stages of Life, whatever. You call it what you want. It doesn't matter to me one bit, although Melissa here would take a different stand. We're going to talk today, amongst taking live calls, about old-timey, let's say old-timey remedies, things that work, things that you've got around the house, alternatives to prescription medications and alternatives to seeing doctors and nurses and PAs and hospitals and dropping a lot of cash and maybe not getting very much for it. So hang loose here. We're going to get started, I think, here in just a moment.
Yeah, we're at 5 after.
Yeah, I'm looking at 5 after.
Hi, everybody. It's Melissa.
This is Channel 9 Eyewitness News chief meteorologist Tom Terry. This is where Orlando turns first for breaking news, weather, and
There
traffic.
we
News
go.
96.5 WDBO.
Hey, it's Joe Kelly. Join me for Orlando's Morning News every weekday
Yeah,
morning.
it's true.
Just ask
He's still waiting for the next shooting downtown.
Wake up to News 96.5
There we
WDBO.
go.
And when you get in your car, listen
Yeah,
to
kind of hard to know exactly what.
96.5
Hooray!
FM.
Oh, how do you like that? Chat's open. It gives you a good, healthy round of applause just for opening it. How nice! Great process. Yeah, great processor there.
On News 96.5 WDBO.
This show is not a medical opinion and does not consent to doctor-patient relationship.
Here you go, the Stages of Life band there with Dr. Klein on drums. And we have Dr. Klein. This is the Stages of Life. And the Stages of Life Medical Institute.com is something that you need to go into your computer right now, or at least right after the show, because Stages of Life Medical Institute.com opens you to a myriad of very informative websites created by Dr. Klein. All of these are informative with no obligation, not trying to sell you anything. But right now, all over the news for, again, the past week, radio, television, Facebook, you name it, it's Dr. David Klein. How are you, Doctor?
I am feeling very, very well. You know, couldn't be any better. Got great weather here in Florida. Things seem to be looking better, improving, looking up in any event. And how are things doing your way, Robert? What's up?
Well, everything up here is good, except it's very boring. You know, you have a development with over 2,000 clubs, groups, organizations, activities weekly, and right now, nothing is happening.
Well, you know, what about the pools? I understand that they're looking at opening the pools up there in the villages.
I hope they do soon because I've got to exercise my legs.
There you go. Well, I'll write them notes, see if that helps.
Yeah.
Yeah. Well, you know, the beauty in this, you know, the data that's coming out with regards to the virus that's among us. You know, this is the Day of the Walking Dead kind of a thing, is that the virus is killed with sunlight, and it's killed with, let's say, you know, ultraviolet light in particular. Heat will do it. And what better place to be than at the beach or at the pool? Okay, where you have an abundance of both. You have your sunlight, you have the ultraviolet rays, and you have heat. So I think that would probably be a whole lot better than sitting around in a closed room eating Cheetos and watching a rerun. I mean, it doesn't make any sense. So in any event, we have to worry about that these days. And the problem, as I see it, is that we have a large state. Very, very dissimilar people all over. And so you have to govern, I would think, based on the fact that it's more like having a large family where, well, hey, Johnny's able to do that. He can go outside. You're not letting me go outside. You know, you end up with this nonsense. You know, South Florida is not the same thing as Northeast Florida. It's not the same thing as the Panhandle. It's not the same thing as Lee County. Lee County is not the same thing as Volusia. It just doesn't work that way. And so when you look at populations' behaviors and risks, they're going to be different in different parts of the state. That really is going to be tricky for the governor because they're not going to forget, well, gee, in Miami, they kept us closed for an extra 3 weeks. That cost us $1 bajillion. You know, it's whatever it costs with an extra zero, because after all, zero doesn't mean anything, right? And then it becomes a political ball. You know, nobody's really gonna make out in this one. So what do I think? You know, I think that we've got to get up off our butts collectively and go back to work. I think it's important more so is that you can't hang around doing nothing. at some point, a matter of pride, you need to get out there and actually make something of yourself. Go out and contribute one way or the other. Sitting around the house doing nothing doesn't do anything for anybody. Put on a yellow jacket, an orange jacket, go out on the roadside and start picking up trash. Do something to make a difference rather than just hanging around drinking beer. And not that that's necessarily a bad thing, but it certainly doesn't help the environment very much and doesn't help anybody else either. So I wanted to mention quickly, because they're doing a lot of jaw wagging. It's the best way of looking at it with regards to testing. Okay, what's it going to take to get us back to work? And they go on and on the one hand, we've done more testing than any place else in the world, and then you flip the channel just a little bit, and you'll have some yahoo from Hopkins will go up there and say, hey, look, we're not doing nearly enough. We can't this and we can't that. But if you're the best in the world or the most in the world and it's not enough for you, well, then maybe you need to find another job or figure out what it's going to take to make do with what you have. When you go to war with the equipment, the ammunition, and the personnel that you have on hand. That's the name of the game. You only have what we have right now. You can try very hard to backfill, but it's not so easy. With the testing, okay, and this is something that I know very, very, very well. I was an analytical chemist before I was a physician. I'm licensed every way from Sunday to look at these sorts of things. And what I will say is this, is that there is no singular test that's going to tell you that it's time to go back to work. If you're looking at serology, which are the antibody tests, they may or may not ever turn positive even if you had the disease. That's something called humoral immunity. What is it that keeps you alive? Cellular immunity. If it weren't that way, then you'd be dead as soon as the virus hit you, because it takes days to weeks to generate the humoral immune system to get those antibodies jacked where they need to go. So how do you measure cellular immunity? And you can't. Okay, so you really don't have the data. If somebody's positive for antibodies, they may have been exposed, they may not have. You don't know the quality, you don't know the quantity of antibodies. And then if you don't do a PCR, something looking for the virus in the upper respiratory tract, you don't know if the person has active disease, whether they have symptoms or not. If that weren't interesting enough, maybe they're not shedding virus in the respiratory tract, but they're shedding it in the gastrointestinal tract. Which it's going to, my prediction, okay, Klein prediction number 2 for the day, is going to be that they're going to find that gastrointestinal transmission of this disease is going to be far more significant than previously thought of. Well, coronavirus is a zoogenic, that means it comes from animals, okay, a zoogenic enterovirus. It comes from the gut. That's what coronavirus does. And so what are you going to do? You're going to find that the GI tract is far more interesting and far more predictable and probably far more important than was previously thought. That's what I think is going to happen. So you can test everybody. There's another yahoo last night who goes, well, we need to test everybody in the United States immediately and then we can go back to work until the first plane from Italy comes in. You know what I mean? Or the first ship from China or the first whatever. It's not going to take very much to damage the population. And it doesn't really matter what you do at any one particular time. It's a statistical game. The incidence of this corona thing is going to decrease with time until next fall. And then fall, we're going to have to worry about this all over again because as we all seem to know about influenza, is flu goes north during the winter and it goes south during the summer. That's the way it works. Northern hemisphere, southern hemisphere, right? So when the birds come up, the flu goes down. And when does it go away? When the butterflies come out and fly. That's when you know that things are going to start to get safer because the butterfly has to have a certain amount of heat, ambient heat, for the wings to work. If it weren't for that, okay, they would stay in their little cocoons. So what are we looking at? We're probably looking at another couple of weeks of this, but does that mean you necessarily have to turn everything off? Well, you keep these things turned off long enough, and a lot of stuff isn't going to turn back on. And that's largely true of small business. So small business employ half of the people in the United States. So these people are going to have a hard time going back to work because there may not be work to go back to. And then what are we left with? We're left with federal, state, and local employees. Now, if those yahoos, okay, had to have a reduction in force the way we do in the private sector, I think there'd be a very different attitude about going back to work. Well, gee, state employees union, you're going to have to drop 50% of your people. So why don't you do like we had to do at the store down the street here and count off by twos and every other person's going home permanently. So I think that we have to look at this thing far more practically. And I'm not saying that they're not, but they need to grow some oranges and actually get out there and say, look,
All right.
there are going to be people that aren't going to make it out of this, and they will anyway. Well, we only had 11 deaths today. Oh, okay, that's 11 more than we should have. But you know something? Okay, being open or being closed today wouldn't have made any difference on those 11 deaths today. And that would be my opinion. I'm sure there are a lot of people out there that will choose to disagree with me, but I don't really care. That's my opinion, and I'll stick with it. But the testing
All
thing
right.
is important, okay? And, oh, by the way, you have an employer that has 30 employees, and you want to go back to work because you have a restaurant. Where do you send 30 employees to get tested? There's no way to do that. There's no mechanism to actually get that accomplished. So what are you going to do? Stand in line, single file at Orange County Center downtown and see whether or not you're one of the 250 that gets selected? No, you actually have to have the capacity to take a group of people and test them simultaneously. If you don't do that, you have a problem. And that's pretty much the way I see it. Now, at stages of life, we're able to do the antibody testing. Is it perfect? The answer is no. It's not perfect. It's pretty darn good, but it's not perfect. What about the PCR, that little thing where you tickle the nose and get the virus that way? We have an affiliated business up in Jacksonville where we can do 500 tests per hour. Okay, can't get anybody's attention. I've been on the phone with TSA. I've been on the phone with Homeland Security, the Navy Department, a whole bunch of folks, and they can't seem to figure out how to take advantage of what's in front of them. So, employers, that's how you do it. You get a group of 30 people together, 50 people together. You have either your company nurse or ours. You go ahead and you tickle the nose with the probe, and it gets sent to the lab in Jacksonville. 500 per hour is the capacity of our machine up there. That's no joke. That's not one of these little Roche machines that does 4 per hour. Yeah, and so, what is keeping people from getting back? It's not knowing what facilities are available. I was watching the representative of Orlando Health today. Well, we're putting together a task force to help employers get back to work. Man, just knowing the way those guys operate. Okay, I'm sure that's going to come with a price tag attached to it. But what does it really take to do it? It actually has to take high throughput diagnostic equipment and a plan. If you're not shedding virus in your nose, you are not contagious.
Okay, doctor.
That's the way I see it anyway. So what do you think, Rob?
Okay, doctor. We're taking incoming calls at 844-220-0965, 844-220-0965. You could text the doctor at 21232. We've got a call from Kathy coming up in a moment. But right now, we'll take a break for the 3 big things you need to know on News 96.5 WDBO.
We got some people watching us on Facebook.
Hey everybody, we're just live on Facebook now. This is Melissa producing the show from Connection Studio, also known as the Stages of Life Studio. Check them out, Stages of Life Medical Institute. Anyway, Dr. Dave.
Yep.
I love how Rob breathes into the microphone.
Well, he's just taking a little breather.
No, he's good. Hey, Cousin Lori. Anyway, so we had some questions, and most of them are, well, hey, Debbie, how you doing? Are you feeling good about things? Let me just look here on my chat while I listen. Let's see. Oh, Karen's so sorry she's late. So, everybody, let's see. We had a daffodil parade back at home in Nantucket. Apparently, they did the social distancing, but they still...
With daffodils?
Yeah, we do that. No, it's that time of year.
Oh, I know. Yeah, I just never heard of a daffodil march.
We have a daffodil parade. Yeah.
Yeah.
And they do all these little things, little floats and daffodils, and it's pretty. And they still managed to pull it off. But Kathy, who's watching us on our feed from Nantucket, she's like, nope, stay at home. Didn't do that this year. There were some cute pictures, though.
Yeah, you don't see too many daffodils here in Florida, do you? The bulbs rot.
Yeah, they rot out. They get too saturated. So, hi, let's see. Hey, Deb, stupid media not working in your car. Catherine's asking, do you think someone will find a cure for the virus?
Yeah, I do, actually. The question is, what's it going to cost? So on my particular Facebook feed, I had a cute little picture of all these pills. Yeah, did you catch that?
No, I saw the one with the girl. Where
Which
it's
one?
like, don't go to the restaurants unless you can go to the restaurants. This was I will find. I'll post a link to it later.
Oh,
but,
yes.
You posted it several places. That was priceless.
Yes.
It was all about the quarantining and what you should and shouldn't do, unless
Unless you should do it,
do it.
in which case you might do it.
And you probably should.
Yeah,
but
don't wear a mask because they don't work, but don't go anywhere without wearing your mask. And
yeah.
it's all the it's all the
all
fun.
the contradictions.
Every one of them is funny.
Charlie
because it's
Sale,
true.
how you doing, Charlie Sale? That's a true Nantucket family as well.
Really?
Whalen families all the way back. Oh yeah. I'm drawing them from home for you, man.
Well, I appreciate that.
How
You know,
about
it's
that?
kind of cool. So it's like that great the Nantucket family, Waylon Jennings. Is that the same?
No,
one?
it's not the same. At all.
No.
Here's a
Different?
question for you, and it's been posed to me as well. Why Miami? If the temperature theory, which you posited
January.
weeks ago,
It's
yeah,
January.
months ago, okay. Why? Most people say that now. They're like, oh, if you go out in the sun, like no crap. Dr. Dave said that in January.
In January.
So why is Miami still a hotspot?
It's a hotspot because of the behavior they did before. Okay, and so what happened was Miami culture is very, very different than any place else in the state. It's more like New York than any place else here. And in Miami, it's this wise ass factor that you typically see. A lot of cruise ships were coming and going, an awful lot of air travel, a lot of people coming in from South America. And by the way, it is the living conditions in Miami in terms of population density are very different than they are here. So you go to Miami Beach, look around. North Miami, look around. It looks a whole lot more like a suburban New York than it does
The
here.
homeless are just poured out on the street on the overnights too. I mean, it's sad.
different. It's different than it is up here.
And there's
so
households, 8, 10, 20 people on top of each other.
it's a real problem with regards to population density. That is not the same state as what we've got going on here. It's like looking at New Orleans. Why New Orleans? Well, because of Mardi Gras. Come on down, let's make it happen. And then all of a sudden you end up with illness. You know, they're going to have to fight their way back from that. Sweden, same kind of a deal. It's not necessarily that we have a shortage of bad ideas in this country. Okay, other countries can in fact share in this. So why Italy? What happened with Italy? Again, it has to do with elderly population. Second thing is population density. The third thing is food hygiene.
Oh, wait,
food hygiene is a
food
big
too?
deal.
Wait, but wasn't the third thing is medical stuff? They didn't care as much about the old
They
folks
don't seem
with their
to.
centralized medicine.
Socialized medicine.
Yeah, socialized.
You are not working. You are a pensioner. You are low priority. They found an awful lot of people dead in nursing homes in Italy. They didn't care.
And Spain too.
Yeah,
Madrid.
they didn't care. Here, you can't really. We don't do it the same way. This is not the same country. But in Italy, the food preparation, the hygiene is pathetic compared to here. Coronavirus is an enterovirus. It goes by fecal-oral route. The same as hepatitis, the same thing as E. coli, listeria, and some of these others. So if you don't have your hands washed when you're preparing food, you got a problem. When you're preparing your food on a marble top like they do in Italy, okay, that's a porous surface, and it's going to hold bacteria. It is not so good. Now, viruses that fall right in.
It's the Stages of Life, featuring Dr. David Klein of the Stages of Life Institute right there in Longwood. If you want a lot of information, I mean more than you'll ever be able to read through, it's stagesoflifemedicalinstitute.com, stagesoflifemedicalinstitute.com. And don't forget, you could hear the doctor and I and other interviewers with the doctor at Stages of Life Radio. That is an app you can actually click on, make sure you've got it, go to your Play Store. That's stagesofliferadio.com. All right, we've got Kathy, Debbie, Edie, Anna, and Bill standing by. Kathy, you're first in line. Go ahead.
Hi. I first have to thank genius Dr. Klein for his words of reason. Common sense is so beautiful. And, oh, my goodness. Thank you very, very much. It's wonderful. And now I suppose I should get off of that and get on to my, I think, a puzzling kind of problem. It seems that, and I don't know quite how to explain this, but like the free edge of my nail, the part that grows away from the finger, is separating from the pink body part of the nail.
All right.
And, like if I even scratch an itch, it like pulls away a little bit and hurts. And because of that, the nail is starting like to crack on the sides, right where the pink meets the like the free edge of the nail.
Sure. Okay. And how long has this been going on?
Oh gosh, only I'd say probably about a week or so.
Oh, that's not too bad. All right. Sometimes what will happen is you can develop, and if it were a little bit longer, it'd be more likely. But generally, when you start seeing separation like that, it's something called onychomycosis. So it's a fungal infection of the nail, and it gets into the nail bed like this and starts growing towards the quick of the nail, which is the lunate. Okay, it'll start working its way backwards and separates the nail from the skin underneath it, and it can be a real drag to try to fix. So you want to get on this fairly quickly. And if you do it, you should be okay with it. And so you can use topical antifungals to treat this. Now, how did you get this? More than likely, you caught your nail on something and then either got jammed underneath it or separated it, which allowed the fungus to get in. So you can dip your nails. You can get something called grapefruit seed extract. Grapefruit, not grapefruit, but grapefruit seed extract. And you cut it 50-50 with water. And you stick it in like a sauce or dish or whatever, and then you soak your nails in it, or soak your nail if it's only one nail in it. You could use a thimble to do this if there's only one nail, and you allow the grapefruit seed extract to get up under that nail bed. The second thing you can try, okay, is tea tree oil. Tea tree oil is a marvelous antifungal, and you use it straight. The grapefruit seed extract, you have to cut 50-50, because if you don't, it'll burn you. But the tea tree oil, marvelous stuff. It does stink like furniture polish, okay? It'll wash off. It's not that big a deal. Or if you really want to play the game, you can take an eyedropper or a Q-tip, or in this case, one of those virus transfer media, little pledgets, the little things that we can't find in this country too much anymore to test people for COVID. You can use those if you're in a pinch. And you can kind of wipe that under the nail. Put a bandage on it, hold it, and you're good to go. And so antifungals are generally what it takes to fix this, but that's probably what went on. There's a mechanical problem that turned into a fungal infection. Now, when you see it with multiple nails, it can be kidney or parathyroid disease can cause it to separate like that. Do I think that's a likelihood? The answer is negatory. I think what you have more than likely is good old-fashioned fungus nail, okay? And the way you treat it is with an antifungal, tea tree oil and or grapefruit seed extract. So Kathy girl, give that a try. Let's see what happens. I think you'll be happy with it. And it does take about 6 to 8 weeks to do this. Okay, it's not going to happen tomorrow.
All right, let's move on now to Debbie. Debbie's on the list of callers, and she's got a question for Dr. Klein.
Got it.
Hi, Dr. Klein.
Hey, Deb. What's up?
I went to the doctor. Good. How are you?
Okay.
I went to the doctor on Thursday because I've been having the doctor said that I have a UTI.
All right.
Anyway, I'm lower left hand pain, like to the left of my stomach.
Okay.
Fevers and chills. I thought it would be getting better by now because I've been taking the antibiotics.
What antibiotic are you taking?
I've never had a fever during the day.
What antibiotic are you taking?
Bactrim.
Okay.
Bactrim.
All right. So Deb, okay, the pain is it the left, like on the same side of your back as or your stomach as the belly button, or is it around back where you feel the pain?
No, it's in the front.
Okay.
It's just right on the side. It's not in the back.
All right. Well, there are a couple things. There's nothing likely about a urinary tract infection to cause this. Okay. If you were having a UTI, it's typically flank pain. You'll see it in the back. Okay. Very, very typically, if it's kidney, you'll see it just what's called the costovertebral angle, which is not too far from where the spine and the ribs kind of run into each other. Up front, left side there, you have the pancreas to deal with. You don't want to mess with the pancreas, but typically pancreatitis doesn't cause a temperature. Ulcer, man, it can cause pain in the same area, and it will also not likely cause a temperature unless you are deathly ill. But there are a couple things going on right now which would bother me if somebody came in with anterior chest wall pain, even if it's lower like that with a temperature, and it's pneumonia. You can have pneumonia, pneumonitis. You can have pleuritic pain, or pleuritic inflammation can do this, and pericarditis. But right now we have an infection going on called COVID that can present just like this. So if I were your doc, I probably would have done two things. I would have gotten I would have gotten a chest x-ray to make sure that you don't have pneumonia cooking, and I would be doing a PCR to make sure that you don't have COVID, because that's kind of what this sounds like, unexplained temperature like that. You sound way too good. Okay, to have a temperature of 103. So the third thing or last thing would be check your thermometer and make sure it's accurate.
All right, thank you so much for that call, Debbie. If you've got more, we can take it up after the break, okay?
Sounds good to me.
Well, I guess we've said goodbye to Debbie. When we come back, more of your calls right here on News 96.5 WDBO.
All righty. So, speaking of which, okay, so, the last young lady, has an issue with chest wall pain. Okay, there are only a handful of things that'll cause a temperature under those circumstances. The most common of which, especially if she can smile, and you can tell she was able to smile on the phone. You can hear a smile, by the way. And that's actually pneumonia. So you have to worry about pneumonia, whether it's viral or bacterial. It can cause this. And a person in her age group, and you know that she's over the age of about 10, okay, by her voice.
Right.
Okay, so a temperature of 103 in an adult is a significant problem. But before you go nuts, you better make sure that your thermometer's working. And they don't always work, especially these electronic ones.
Fair enough.
So what you want to do is to change the batteries and try it again. And if it comes back normal, you know that you just alerted everybody for nothing. And this does happen.
All right, we get some questions that are specifically on the Facebook right now, not on the radio.
All right, what you got?
First of all, Joanne says, just joined you. I need to heal my gut lining after recovering from an ileus. Herbal teas, she says?
No, actually what you want to do, there are two things that work beautifully for this. One of which is an amino acid called L-glutamine. That's capital L-glutamine. The dosage is 5 grams a day. That's 5,000 milligrams. And you can take it all at one time. At Stages of Life vitamins, we have one that's 1,000 milligrams per capsule. You take 5 capsules every morning. The second thing you want to take is colostrum. Not the liquid, but the powder, and that will tighten up the tight junctions in the gut. The combination works very, very well. Teas are pretty useless. Green tea is helpful for other things, but it really isn't going to help you in the way that you want to be helped. So the combination is L-glutamine with at least 5 grams of colostrum every day. And so if you go to Stages of Life vitamins, we have one called GI Shield, which is the least expensive way to do this because it comes in a powder form and you can just use 1 scoop. And that should do it.
Okay, now we've got Joe. Says, Doc, I'm a 60-year-old guy. Take 10 milligrams lisinopril, no other prescription meds, decent multivitamin, and your colostrum. Want to boost things and keep things normal as I age into decent health, never in the hospital. Seeing very confusing side effects from FDA studies when taking lisinopril with supplements like inositol, hyperfoliate, and some other normally harmless supplements. In all these FDA studies, it seems the reactions are worse at 60 or over. How do I choose? Do I stay on the path or...
Okay, well, the long and short of it is I'm over the age of 60 and I take both of those things and it's not a big problem. The deal with lisinopril, okay, is that it's a marvelous antihypertensive. It's not very strong. The dosage you're taking is actually rather mild. The hyperfolate, I'm not familiar with any side effect that I've ever seen with that, with about 60,000 doses. It's not a big problem. Inositol, same thing. You get inositol in many foods. They don't tell you not to eat foods containing inositol, now do they? Inositol is a B vitamin. It's a very, very interesting but not well recognized B vitamin. And there are no effects with lisinopril. It just doesn't seem to happen. So what would I do? I'd be taking it. Okay, and FDA doesn't do studies, actually.
So stay the course?
Stay the course. FDA doesn't do studies like that. They commission them. So, I'm not sure what you're reading.
That's a good point. All right, let's see what else we got. Joanne said, thank you much. Karen says, Representative Steffi Murphy is indicating that testing sites are up in Seminole County for anyone, regardless if you're sick or not. They want people to be tested. Are you familiar with what type of test those are?
I'm not sure because they're not actually telling you what type of test they're doing.
Or
and that's
how long the
that's a
return
problem.
is, yeah.
Oh, yeah. And so I was watching some of these things. Well, we should get the results back in 5 to 15 days. That would be a PCR. Okay, that's the virus test itself, looking at the RNA. That's the one that we do up in, we do those up in Jacksonville. It takes us we do 500 per hour. So it's a little faster than those yahoos are getting it done. But, okay, if you're looking to go back to work, you need to get everybody done at one time. And when you're going single file through a line like that in your car, you have an office of 30 people, do you really think that's going to happen? The answer is no. So the way to do it is to get 30 people into sitting on a table. This is the way we would do it in the military. You sit at a table, and then everybody goes ahead and either swabs himself, which is just fine, or you have somebody, a designated swabber, go zing, 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 zing. Somebody is photographing the driver's license and the paperwork, and then you kick everybody out. How long does it take to run the studies? 15 minutes to do the antibody. So it really depends on what they're doing, and I'm not sure what they're doing. Now, interestingly, looking at some of the local hospitals here, 60% false negatives, even doing the PCR. And you know what that means? It means they didn't know how to put the swab in the nose. Okay, they didn't know what they're doing. If somebody tells you, it hurts to stick it up the nose, two things you need to know about that is that it doesn't go up the nose, and if it's done properly, the worst thing it's going to do is make you want to sneeze. And so that's utter and absolute nonsense. So no, I don't know what they're doing down there. I'm not so sure that they know what they're doing down there. So, but that's just my opinion. I will share it with you.
Because that's what he does.
That's what I do. Yeah, they're not well trained. You don't shove it up the person's nose. We're watching this guy do it for the president. You don't stick it up the nose. You stick it straight back. Dr. Siegel. Oh, we're going back on.
96.5 WDBO.
Welcome back. Stages of Life featuring Dr. David Klein every single Sunday afternoon at 3. Tell a friend. They need to be tuned in, especially now with medical news on top of the heap. All right, your calls, 844-220-0965, 844-220-0965. You could also text the doctor at 21232, Back to the phones. Anna, thank you for waiting, and you're on the line live with Dr. Klein.
Hello, this is Anna live with Dr. Klein. Hey, hi guys, thanks for taking my call. And what I'm calling about is something kind of weird. My father, concerned over he and my mother driving in a vehicle that has a terrible oil leak. Like when we pull it up to a red light, you see like all this smoke coming from the engine. So and of course we're in Florida, so you always have the AC on. The car reeks. So I'm wondering how detrimental is that? Like, is it killing off the brain cells? Are they going to die of like cancer breathing it in, or is it no big deal?
No,
and that the filtration system, it's cool.
Okay, what you really want to do is to go with your common sense on this one. So if you go in someplace and you have some horrible toxic smelling odor, it's not likely to be doing you a lot of good. Okay, well, what type of damage can happen? Well, very much the same kind of damage that can happen if you smoke. You're pulling in all kinds of things that damage the alveoli of the lungs. And then more interestingly, some of these volatile off-gassed hydrocarbons can cause damage to the nervous system, to the heart, and to the brain. It takes a substantial amount to do that, or it takes a lot of it over a long period of time. What you need to do is to tell your folks, say, look, I'm going to take your car and have it repaired, okay? And then you just take the keys and you go, because that's the way we had to do my parents. It was the same kind of a deal, because as you get older, or as you get substantially older, you become more and more like children. I know I am, okay? So they're constantly taking away my toys when they start to hurt me. So yes, okay, oil fumes like that are a problem. Okay, that's not a good thing. You can actually start to feel dizzy or dysphoric from it. You can kill insects with it. All right, so no, you really wanted to go ahead and fix this thing. So where's the oil leaking to? It's probably going from the crankcase down onto the tail, the exhaust system. So this may not be that big a deal to fix. That's where many of these things happen. But could it happen at the top of the block? The answer is yes. Okay, Larry Perry, Magic Mechanic, could probably go over this and start asking you a bunch of questions and then tell you to come in and have it fixed. What you do is you take it in after you've driven it a little bit, and then you watch and you look and you smell where that smoke is coming from. But in my experience, when it comes up in substantial amounts like that, it's almost always sitting off the exhaust system. So, and if that's the case, they're probably going to have to lift the engine up, go ahead and put a gasket up underneath, and it's good to go. So do your parents a big favor. Take their car, have it mended, and then give it back to them. That's a marvelous Mother's Day gift. It's coming up. What do you think?
All right. Well, thanks for your time. I appreciate it.
It's my pleasure.
Okay, but don't take your car to Stages of Life and ask Dr. Klein to fix it. Oh, he can do it.
It's been
He's
a long
really
time.
good under
It's
the
been a
hood.
long time since I have. I got to tell you, I was an automobile mechanic years and years and years ago, and I wasn't any good at it. I didn't like getting my hands dirty. So,
my.
so I went into medicine. What do you know? So, but now Larry does the work.
All right, everybody, check out stagesoflifemedicalinstitute.com, stagesoflifemedicalinstitute.com. On your computer, you're going to find so much information that leads you to, and it's all from Dr. Klein. It's mostly stuff that he has created. If not, it's stuff he endorses. So let's get back to the phones. We have Bill on the line. Bill, thanks for holding. What's your question?
Hey, doctor. I'd like to know why nobody's put a stop to the Institute of Virology in Wuhan, China. This latest outbreak came from there, and outbreaks have been coming from there for the past 20 years. I guess the World Health Organization is in on it. I guess the CDC is in on it, and I guess Homeland Security is in on it.
Well,
if you have a man-made virus that keeps coming from one place and nobody puts a stop to it, tell me what's going on.
Well, Bill, I would have to ask you this question. Okay, how would you stop it? So if you knew that this was happening, what would you do? What would the first thing you'd do if you could?
Wait a minute.
You can't stop it.
Didn't we put a stop to Adolf Hitler?
No, you can't do it,
II?
Bill. You can't do it. That's foolish talk. Now that's foolish. Okay. Now you can identify where it came from, and you might even be able to scold them, and you might be able to cut off the World Health Organization, which I think is a really, really good idea. But you can't go into a sovereign nation, especially when they have 3 times as many people as you have, and think for a minute you're going to be able to tell them what to do without setting off some kind of major war. Big deal. It's a horse of a different color. What they did, okay, was unconscionable. But if it were weaponized, I think the last place you would do it would be in your own backyard. That makes absolutely no sense. So what they did was they screwed up. So there's a technician over there who's probably disappeared by now, if you get my drift, okay? Because that's what happens when you screw up in China. You disappear, and so does most of your family. And if you're from North Korea, your extended family, you all kind of disappear permanently. So what do I think? I think we know where it came from. I think what they did was they intentionally misled us. And I think we're probably going to take economic action because, you know something, that's the only thing you can do. We can't make Mexico do anything. We can't make El Salvador do anything. And I'll tell you what, we're certainly not going to be able to make the Soviet Union or China do anything. So yeah, it's one thing to be angry, and I agree with you. I'm a little angry about it myself. But there's an awful lot of talking going on about it, and there's an awful lot of consideration for what actions may be taken. But realistically, you can't bring the country or the world to a brink of war because to punish somebody. It just isn't going to happen. The best lesson to that was the Korean War. Okay, we couldn't take the Korean peninsula from the Chinese, okay, after we were at our strongest posture after the Second World War. So the Korean War was a draw, and we almost lost it. You can't travel halfway around the world and really expect to be able to make somebody do something like that. It's irresponsible and not realistic. So maybe we ought to move on to the next one. Let's see who Victor wants to yell at.
All right, here we go. If you want to call into the show, it's 844-220-0965. 844-220-0965. We have open lines right now, but let's move on to Victor. Victor, what is your question for Dr. David Klein?
Hi, Dr. Klein. I talked to you many months ago about my diabetes 2.
Okay.
And you sent me, I paid for, and you sent me Magic Minerals.
And Diabetstat.
Diabetstat.
Yes.
Yes. I've got both of them sitting in front of me, and I take them. Unfortunately, I don't have a good Medicare D, and I don't have a blood tester that works.
Okay. Well, why don't you have Medicare D? Why wouldn't you have Medicare D?
I do. It's just the one I have is not very dependable. I don't know that I should say their name on the air.
Yeah, we
but
can't.
You didn't like it. My doctor doesn't like it. You know how that goes.
Got it.
All right. Now, I was thinking of Health First because they're local, but I'm afraid my my orthopedic surgeon doesn't like them. But is there anybody else you recommend? And then I'll switch back to diabetes 2 real quick.
Okay, the answer is very, very quick. Okay, you get what you pay for. Okay, and when you go cheap, you're going to get cheap, and that's just the way that it works. Many of these Humana, Golden X, Y, and Z's, are really pretty disadvantageous. Let's just say Medicare Advantage plan is not an advantage. It's a cheapening of the best insurance you can get. So you're going to have to give away something. So you have to decide what you're going to do. So what I did is I did not opt to do a Medicare Disadvantage plan. I have regular red, white, and blue Medicare, and then I picked Mutual of Omaha for my supplemental, and then I picked Aetna to handle my prescription. That was the way I did it. When you make them dissimilar, then they can't roll you involuntarily into a Medicare Advantage plan. So if they try to tell you, well, if you get them both together, you get a discount. Oh, they'll discount you, okay? They turn the whole thing into a Medicare Advantage plan, and you're goofed for a year. Not a good thing. So now, do you need a supplemental plan? And the answer is no. Okay, what's the typical Medicare copay in my office? It's about $18. So it's not unaffordable. What do you do about your prescription plan? They're typically very inexpensive also, $20, $30, $40 a month. So none of these things are all that expensive. But if you think you're going to get it cheaper than that, then you're probably never going to get a diabetes machine that's going to work, because they're expensive and the Lancets are expensive and all that kind of stuff. You're not going to get it on a cut rate policy. When you have diabetes and when you have age on you, the last thing you want to do is to go cheap on your health. What are you going to do? You're going to buy a nicer box to get buried in? It doesn't make any sense in my world. There are very few things more important to you at any age than your health. Your family ranks in there, your job ranks in there, your education ranks in there. But after that, okay, there's not much more that really means much. It's all junk after that. So I would be inclined to get a better insurance plan, understanding the value of it, and look at what happens when you get a lousy one. This is typical. We have a lot of people that have good plans and then they don't pay attention and they get rolled into disadvantaged plans. Okay, and typically there's a way to get out of that. I'm not going to get into on the phone, but it's really, you don't have to wait a year to get out. There's a trick to it. Okay, so in any event, so what's your issue with diabetes too? So what's your question?
Well, of course, I don't have a tester that works, so I have no idea what my reading is. But I have gone from 11.5 to 8.5 on the A1C.
Okay, all right.
That's a few months ago.
That's horrible to awful. But go on.
Start.
Yeah. All right. I like seeing.
How low should it be? About 6.
I like to see them around 5.4 to 5.6. That's my goal. And we're able to do that for about 80% of our patients. And how do you do that? Okay, you do that with a combination of prescription medications, because they're very, very inexpensive. Then you use the magic minerals and the diabetstat. You need 2 twice a day of the magic minerals to get it to work, and 1 twice a day of the diabetstat. What that does is it's necessary for the insulin receptor. Okay, vanadium and chromium deficiency can cause diabetes type 2, but there are other things that you need to look at. So I'll typically start people with metformin. Why? Because it's free at Publix. I don't care what your card looks like. Free is free. And if they charge you more with your card, you ask them not to use your insurance, which, by the way, is common sense. If you need to add a little glyburide to it, that's what you do. But the diabetstat, which is high-dose vanadium and chromium, and then the magic minerals, which is zinc, selenium, vanadium, chromium, boron, silicon, manganese, and magnesium, is necessary for the balance of it. Now, there are other things you can add into it if you need to. Inositol is a great one for diabetic management. It also has a side effect called lowering cholesterol. So that's a real problem. It's also an antidepressant, another real problem. And what does it cost? About $11 a month, and nobody's insurance pays for it. So, Victor, I remember you very, very well. Okay, were I you, I would have taken the advice and gone across the street to the insurance sales guy over there, and then he could sit down and work it out with you and show you what you can get and get you the best value. But you're not going to find it. I don't think you're going to find that type of service in Titusville, frankly. So regular Medicare is what you want. Okay, why? If you need an orthopedic surgeon for joint replacement, you don't want to go to brand X, okay, for this. You don't want to go to the cheapest orthopedic surgeon in town. I promise you that doesn't end well. More so, when you're on Medicare, the best orthopedic surgeon and the worst orthopedic surgeon charge the same. Okay, so you can go to the head of the line, you can get the top flight, you can get the A seating, you can get center row stage for the same money. So please do it.
I couldn't find center road stage.
All right, Doctor, we've got to take a break right now for the 3 big things we need to know on News 96.5 WDBO.
Even the doctor falls prey to, what did you say? You must have said something that sounded like Siri or something.
Yeah, I must have. I don't know. Well, I used to do this just for grins. I'd say, okay, and everybody put your speaker very, very close to your Alexa.
Oh, don't do that.
Oh, yeah. See,
program everyone's
oh,
Alexa.
no. What you do is say, Alexa, I'd like to buy an annuity. And then your phone will never stop ringing.
Oh,
is that mean or what? Or
that's horrible.
Oh,
all right, look, we got a lot of questions I want to get to. Iggy said that a friend of hers, 40, had got her finger nicked by a manicurist, a nail tech.
Okay.
And it's been swollen for a couple of weeks. Got 2 rounds of antibiotics. Did not have any effect. There's nothing under the skin.
Okay, there's a thing, you're going to love this one. There's an infection you can see in the tip of the finger called a felon. That's Felon. And it's most typically going to be viral. So if she went on 2 antibiotics and it didn't seem to work, the next step would be to start an antiviral. And that's probably what it's going to take to fix it. But you also have to be very, very careful that there's not a foreign body sitting in there. A piece of a nail or a piece of something causing it.
There's nothing under the skin.
You can't really see or tell.
Yeah.
Okay, my money says that there's probably something in there. It could be a fleck of something, a fleck of your what do you there's those gel nails that the gals put on there. Yeah, a little piece of something is stuck in there.
Why do you think they've always covered their mouths when you see them and doing the little nail techs?
Well, keep them from, yeah.
Okay, let's see. Catherine has a question. She takes 40 milligrams of citalopram in the morning.
Celexa, sure.
Quetiapine.
Okay, got it.
25 at night milligrams. Half a lorazepam only when extra anxious. I take vitamin D3 gel caps, 25 mcg, 1,000 IU. And vitamin C 1,000. I take the vitamins in the day. What can I do to keep me healthier?
Okay, a couple things about that. You're not taking near enough vitamin D. Okay, the dosage should be a little closer to 5,000 per day. Vitamin D3 in that dosage will cut your risk of cancer in half. So where do you find that? People say, well, how do you prove that? I don't have to prove it. I can go in the National Library of Medicine and read it. So you go on something called PubMed, PUBMED.gov, and you type in cholecalciferol, which is vitamin D, or you can just type in vitamin D, put a space, then put a plus sign, and then you write cancer prevention, and see how many articles pop up, and there'll be over 1,000. You can put in similar search in there for vitamin D and cancer survival, and there'll be about 1,000 articles.
Okay.
So that's the first thing you want to do. The second thing, the medications that you're taking, I'm curious to know what you're taking the quetiapine for. And
at night,
yeah, that stuff can be a real problem. Okay, the lorazepam not going to be a big issue. The Celexa is not a big problem, but no, it says 25 milligrams at night.
Yeah.
Okay. Is it just if it's just to sleep? I'd be finding something better to sleep.
Yeah, like melatonin.
Like melatonin, GABA, L-theanine. There are a bunch of them, but there's something not quite right with that. So the only thing I would start with would be the vitamin D, without knowing more about you.
Karen wants to know if there's a way to get off thyroid medication.
No. Generally speaking, when you're hypothyroid, okay, it means your thyroid, for whatever reason, is not functioning properly. So I take Nature-Throid and have for, 10 years. My daughter's been taking it. It's just the way it goes. As you get older, thyroid function diminishes. When you know that this happens, the good news is thyroid medicine is very, very inexpensive. Mine cost me $18 a month. So I think it's the best thyroid medication you can get. Some people it takes all the way up to $35 or $40, but $18 is what mine cost. So there are things you want to do to get your thyroid to work again. Zinc and selenium; those 2 minerals are very, very important to get the thyroid to work. So I use one called Magic Minerals, just like the previous caller, and I used that and developed it actually for thyroid disease. So you take 2 capsules twice a day. Works beautifully. It's not a bad way to go, but as far as thyroid's concerned, taking a pill a day is not that big a deal. I think there are many more serious problems, I think, I would be more concerned about. What do we got next?
Finally, Tommy's mom has been very panic-stricken lately.
Why, Tommy?
Well, because she's older, and we've got this COVID, scare all over the news and media.
So they're panicking your mom. So what would you like me to tell you? What can you do to settle her down? I don't know. If I could figure that out, I would settle my wife down. she's every bit as panicky as everybody else. It's scaring the heck out of people. As a general rule, when you don't know what's going on, you'll become fearful, panicky, and then you start finding your way into a dark room. So what do you do about it? You just kind of wait it out. I don't think there's really any way you can convince your mom that she's wrong, and she actually may not be wrong. That's the sad part. There's something to worry about.
True. All right, let's see what else we got. Oh yeah, Tommy also said his VA doctor, who he's very happy with his VA.
I used to be a VA doctor for 4 years, but go on.
They get a bad rap, I think. He said just recently put him on the vitamin D3.
Good. How much is he putting you on, Tommy?
I hope it's what we've been talking about.
The dosage that you're looking for is 5,000 IUs a day to start. Okay, and you always take vitamin D with a fish oil, otherwise it doesn't absorb. So that's something you can teach the VA doc, because just telling somebody to start on vitamin D3 or giving you the cheap stuff they have at the VA doesn't do it. You have to take it with a fish oil or a shot of olive oil. Vitamin D is not a vitamin. It's a hormone, okay, and it's a steroidal hormone, which is dissolvable. It's soluble in oil. If you don't have oil in your stomach.
Stages of Life featuring Dr. David Klein during the week, 407-679-3337. That's 407-679-3337. You will be in contact with Iris. Be nice. Okay, let's go to Steve. Steve, you're on the air.
Steve, what's up?
Gentlemen.
Hey.
Great talking to you again. Previously, I had called you about a mild cough I had developed.
Yeah.
You suggested it might have been my lisinopril.
Yep.
I stopped the lisinopril. You were absolutely right.
Okay.
Cough, and the urge to cough has gone away. Now, what should I take instead for my blood pressure, and are there any supplements that help with that?
Yes, but I want to point something out here. Okay, that COVID-19 is thought to actually enter the cell by way of the ACE2 receptor, which lisinopril tickles. So it's the same receptor that COVID uses to enter the cell, which is one of the thought processes with regards to folks that have hypertension are more susceptible to COVID.
I don't ever respond.
Yeah.
Let's just move on.
There you go. So the question is, okay, does that make you more susceptible? And the answer is probably yes. What would I be taking? The answer would be amlodipine. That's amlodipine. Dosage there to start is 5 milligrams every morning. And that is usually enough to get the job done. If it isn't, then I'll add an old-timey one, depending upon your age and your prostate condition. In other words, like if you're like the rest of us old guys, you're going to find yourself waking up in the middle of the night, and usually to urinate. Then what I'll do is I'll kill two birds with one stone, which is a lousy medical metaphor, and I'll use one called prazosin. I'll use 1 milligram at bedtime. I wait a week or two, bump it up to 2 milligrams at bedtime, and then watch the blood pressure come down and watch the frequency of nocturia, which is the urge to wake up to go to pee. It starts to diminish. If you don't wake up to pee, then I use one called clonidine. Now, the story with clonidine, 0.1 milligrams twice a day, is that it will lower everybody's blood pressure. It does it predictably, easily, and inexpensively. Neither of these two medications, I believe, cost more than $10. So, Steve, give that a try next. I'm glad you're over the cough. But it's very, very typical. So that was an easy one.
Very good. Let's move to Charles, and then it's going to be Ralph, and that's going to wrap up the show. So we've got to do it quick. Go ahead, Charles.
Hi, Mr. Doc.
Hey.
I'm 92, and just the last couple of weeks, I've had about 80 breakout spots on my back, and they're sort of reddish color.
Do they itch?
Very, very itchy.
Yeah, you have something called shingles there, my friend. Okay, so what you need to do is you need to find your way to the to your family doc, who hopefully has office hours these days, because you need to be seen and started on an antiviral by mouth. In addition, and Charles, I'd like you to write this down. The one that I prefer is called valacyclovir or Valtrex. You take 1 gram twice a day. That's fine. You can use others, but that's my favorite. But then add baclofen to it. That's spelled BACLOFEN, 10 milligram tablets, a half in the morning, half in the afternoon, a whole one at bedtime, and naproxen. If you do the combination, it decreases your risk of developing something called post-herpetic neuralgia. So you need to get on this. So your doc gets a telephone call tomorrow, Charles, and tell him that you and I chatted and that I thought that you had shingles on your back and you need to be seen immediately. So, Charles, will you promise me you'll do that?
Yes.
Okay, my friend. Okay, so that should square that youngster away. 92 years
All
old
right,
with
let's
shingles.
move him along, and let's get to Ralph.
Hello?
Hey, Ralph, how are you doing?
Ralph,
Quickly.
you're on the air. Go ahead.
Fine, how you doing? Pleasure to talk to you.
Oh, it's our pleasure.
Long-time listener. First time checking in with you. I work at a wastewater utility, and I've been doing it for quite a few years. We deal with biosolids. We use conventional kind of disinfection using sodium hypochlorite.
Yeah.
Just bleach on steroids, and we do just a biosolid cake, and we put it into a truck. My concern is the fact that there's a lot of conversation about that the virus can be into the wastewater stream, into the biosolids. Yet, and there's nothing in the water. My concern is, I'm exposed to it constantly. What is the risk ratio? Because I'm not.
Okay.
I contacted the department.
Well, there actually is more to it than just coronavirus in that type of water or brown water. You also have to worry about a bunch of other things parasitic as well. Wear a mask, okay? Just get yourself an N95 and wear it when you're around it, and that should square it away. Either the N95 is the perfect mask for this, actually. This is the perfect application, and that would be my recommendation to you, Ralph.
Thank you to all your callers. You did a great job today. You filled the phone lines for the entire hour. And, of course, we want to thank Dr. David Klein and the entire staff at the Stages of Life Institute, and that's at 1917 Booth Circle in Longwood. Let's go into the news, and then we'll continue to ask the experts all weekend long.
Well, look at that, Dr. Dave.
We
Looks
got
like
her.
you handled it. Let me just go ahead and disconnect this here. Boy. All right, and we had one more question here. I believe it was something. She answered your question. You asked why she was on the ketiapine.
Yeah.
And she said it was an add-on for severe anxiety over 6 years ago. When I asked Kathy, I said, "Is that anxiety med monitored by a shrink?"
Yeah.
Or is it
I would ask.
just being handed out? So, Kathy, anyway, you might want to look into that if it's just,
Ketiapine that's tough stuff. That is really, really can be
It's
nasty.
heavy duty.
It can be, yeah. And so that's one that you just
Thanks,
don't give
Iggy.
somebody for a little bit of anxiety.
Yeah, Iggy said another great job.
Well, thank you.
Yeah. So anyway, we're gonna go. We'll see you next week, 9 o'clock to Thursday night on another radio station.
There you go.
Dave will be talking then. So anyway, thanks everybody. Say bye bye.
Later.
Later. That's good stuff.